Hi, this is Jerry,
I'm Gerald.
and today we're looking at a natural remedy for asthma cough. And this is going to be very, very short. I want to bring you something that I have found to be effective in dealing with asthmatics. And a lot of times, people who are asthmatics will get very emotionally distressed at the time when their lungs are closing up. The various small windpipes are closing up, and they feel like they're going to choke to death, and they just can't get any air. So what I found was effective. I had done this several times, not as a doctor in a clinic, but just as friends who adults who had asthma were to some degree beginning to freak out a little bit. I would just go up and I would look at the person in the face, and I'd say, let's breathe. Let's just breathe normally. In and out. Everything's going to be calm, be fine. Just breathe in and out very slowly. And I will say, you need to feel the breath across the top of your lip as you breathe. And by being calm with this person and saying it's going to be fine, you may hold their hand or something like that. The point is that their flight or fight response to thinking they're going to die, because it feels like they're going to be starved to death of oxygen and just die. They know their mind knows better, but you get scared. So if you have a chance to work with somebody, just take their hands and very calmly talk to them and say it's going to be all right. We're going to get through this. Maybe they've taken their inhaler, but it's not working fast enough or whatever. Now you need to access the brain and get that person to just relax. And so that's one of the things that I use to help with an asthmatic who has a cough or feels like they're shutting down. And there's not really any medical to it. It's just one person caring about another and trying to help. Now, I'm going to tell you something that may be very irritating. You may not know. I was furious when I heard this because my son Gerald, who is paramedic and also studying to be a flight medic, he suffered from asthma when he was a child. Doesn't have it now. But the problem was that we did not know as parents what was a contributing factor, and that is acetaminophen. Acetaminophen, before it ever went on the market, people knew in trials that it could cause some pulmonary distress with children, yet it went ahead and went on the market. And studies have proven that, and if I get the percentages right, okay, if I don't, you get the general idea. If you give a child acetaminophen, and I will not use the brand name, because now there are several brand names for acetaminophen. This material, if you give it once a year, you may increase the child's possibility of having asthma by 5 or 10%. If that increases to once a month, it goes up to between 20 and 40%. And if it's given more often than that, where it may be once a week because a child has other problems, you may be in the 80% range of having a child who has chronic asthma. And that's insane that in this country, knowing that this is a problem and it's been published and researched, that product is still on the market. It's nuts. And I didn't know that was a problem when he was a child. So now we know. And I will tell people, whoever will listen, please do not go down that road if you have children, because it's not worth getting rid of the swelling or the pain or anything else to induce some kind of inflammatory response in the pulmonary system of your body. It's just not worth it. And so that can be a reason why a person has an asthmatic, and it's really tragic.
There's some other contributors to the cough itself. It's your lungs are trying to get rid of things.
Yes.
And so asthma in particular can be triggered by things that, of course, your body naturally wants to get rid of, just by default, and because you have an allergen to environmental particulate. So stay away from those things, or get allergy tested. Of course, go talk to your physician and see if there's a way that you can get treated for your allergens. And sometimes those allergens are in food, and you can be contributing to inflammatory issues in your body. That, of course, asthma is an inflammatory issue. And so you don't want to help that propagate itself by increasing whatever is increasing inflammation to begin with, up to and including poor sleep, dehydration. And, you can suffer a lot from just negating those two things. And then it's detrimental to the system in general to do that. But then if you can help those things be remedied, and if you can get allergy tested and you can try and find your way out of an allergic response such as was described, in the worst case scenario, as a paramedic responding to an asthmatic episode, there's a lot of things we try to avoid. We will take the patient and shelter them in the back of the ambulance away from the environment that they may be in, which could be contributing to the inflammatory response. We use bronchodilators, and of course whatever the patient already has. And all this is common knowledge, but the point is, the approach is to take the patient away from the things that are causing the most issues. And so with calming techniques, that is something that a paramedic will use, is the established rapport that comes with human contact, and making sure that the person not only trusts that you're going to help them, but getting consent to do so.
Yeah.
And then from there, you can begin to find the calming things about the patient. You go to that happy place. You try and help that patient find that happy place that will allow them to get past the idea that their bronchial space is closing. And that is scary. And so on top of that, you've got secretions. So a typical asthmatic is secreting mucus out of his mucosal membranes all over his bronchial tree. And so he's got all kinds of issues on top of inflammation. So he's got not only constricted airways, but also gunk. And so coughing, trying to get rid of that, that's a natural response. Though, if you can avoid those things and then get past the point where you're simply just trying to cough whatever it is up, and suspend the inflammatory response, how can we help the cough itself? So we're trying to get rid of mucus. What's the thing that we can do to decrease mucus production? Maybe naturally,
hydration is always a problem, and as I've said over and over and over in almost every video, I've never seen anybody that comes in my clinic that's properly hydrated. And I know that children, as well as adults, do not develop a proper hydration routine, and they carry that on into adulthood. But it's absolutely horrible for an asthmatic person to not take that in, and then you get the phlegm and all the secretions in the lungs because there's not enough fluid to help expel that. I will say that there are 2 or 3 things that I would recommend, and we're going to leave it at that. One is avoid acetaminophen. That's number one. The second is avoid nightshades. If you have a child or a person who is an asthmatic, avoid nightshades. That means any form of tomatoes or red peppers or eggplants or material like that, those are extreme irritants to the body. And I know I love chips and salsa as much as anybody else, but an asthmatic has absolutely no business taking that into their bodies, because there is a inflammatory response, and it's just that you've got to maintain the proper amount of sleep. You need to go to bed at a proper amount of time. You don't want to eat and then go to bed. You want to have at least 3 hours before you go to bed, because the idea of going to bed and sleeping is to make repairs in the body and to clear out toxins. It's not to digest food. And the body will take care of something that's most urgent right away. And in this case, that would be digesting the food and putting everything else off a little bit. But if you only have 4 or 5 hours of sleep, now you're accumulating toxins that were never taken out. If you don't have enough hydration, now the lymph system isn't working properly to pull all those toxins out. And that is absolutely tragic for an asthmatic person.
And
it adds to all of that.
And if you do eat late, you're contributing to one more thing for your body to do.
That's right.
While you're trying to do all these things that
That's
you just
right.
described.
And the body isn't going to do it.
So you can engineer out one of the inflammatory issues.
Absolutely.
By just engineering your day.
Yes.
The structure of your day to accommodate what could get you down.
That's right. Well, until next time, this is Jerry.
I'm Gerald.
And we're excited to bring these videos to you. We release them every single day. And we are putting these videos together because they're topics that you've asked about. And we're trying to address those. And we're really somewhat taken back by the kind words that you have given us. And so we're going to keep working for you. And I've asked Gerald, who's bringing somewhat of a medical point of view to some of this from a view of a paramedic. And with the understanding, we give no medical advice. We tell you go seek a medical professional if you have some medical discussions to be had. But we're looking at just a common sense approach to try to find something that might work for you that would be considered something natural. So if you like what we're doing, hit the like button. And if you can, subscribe. We'd love to have you. It's something that we're very, very interested in knowing how you feel about stuff. So until next time, be well.
There was one more thing.
Go for it.
Just with the asthma care and talking about medical advice. Of course, we're not giving medical advice itself, but the thing is, make a list. Make a list of your ailments. When do you suffer these things? When do you what are you suffering and when are you suffering it? And then, of course, bring that in. Make a list. Few people go into a doctor's office very prepared. Don't be that person. You're slowing the doctor down. They're busy people. I talk to them every call, and I kid you not, they are busy. They don't have time to hear a bunch of what your cat is doing. I'm sorry, but the thing is, if you go in there with a list and you're prepared, people go into grocery stores more prepared than they do to doctor's offices.
That's true.
And you should bring in, I'm dealing with this. It's that time of day where I go through this. Next, I go through that. Bring that list in with you. Make that a priority to talk with your physician. And in the meantime, while you've addressed those things and you figured out you're not going to die from something immediately, maybe take care of the maintenance things like he just talked about. And this is one of them.
It's important if you do that with your physician. It's also important for naturopaths because on many occasions I have seen such lists. And the patients, I will look at, we refer to naturopaths as clients. My client will bring something to me and I will look at this and say, go to your doctor, your medical doctor now. I mean, right now. Don't stop to collect $200. Just go. It's important to go now. And they'll press me as to what that is. I said, I cannot give you medical advice. Take this list to your doctor and sit down and have a conversation. Don't do it next week. Go as soon as you can. And in a couple of cases, I knew that these people were pretty close to a coronary, and they were able to avoid tragedy. And that's our job. Send them to professionals. So, and again, until next time, be well.